Hi, this is Minis Joannides, the Chief Medical Director at Optimum Life Reinsurance, and this is the Optimum Academy Heart 101 series, video number 7, using NT-proBNP. So let's get started. So what can an EKG offer us? As we talked about in our last session on EKGs, it can tell us whether the applicant is in a normal sinus rhythm, if there's any extra heartbeats or heart blocks, any arrhythmias, abnormality in their rhythm, or whether there's a pacemaker present. And it can give us clues into things like left ventricular hypertrophy. And then there's some other clues that can also give us in terms of other cardiac, pulmonary, or even electrolyte issues. So what's the evolution from an exam electrocardiogram done by a paramed to using a blood test, the NT-proBNP blood test? So EKGs provide a picture in time of the electrical activity of the heart, right? So at the time the EKG is done, this gives us a picture of what's going on with the electrical activity of the heart. So it gives us the clue into the underlying activity and any potential abnormalities. It's got 12 leads, as we discussed in the EKG webinar. However, when paramedics do the exam, the EKG is often missing leads or has reversed leads. There may be electrical artifact. There may be incorrect standardization or wrong paper speed, or the EKG, for whatever reason, may not be done correctly. And then, of course, it has to be read by an expert who is a regular reader of electrocardiograms. So we're hoping for the 12-lead EKG on the left, but often what we get is the disaster on the right. So you never know what you're going to get. Rarely an EKG has to actually be repeated because the result that we got was so poor that we cannot make any decisions on it. So the evolution to using a blood test is, what can we do to maybe avoid all the problems related to getting an electrocardiogram and having it interpreted? So the paramed EKG adds cost to the requirement expenses. It costs, possibly $50. It has to be interpreted by an expert, so you're paying the person interpreting. There's a time delay with the tracing, imaging it, and getting it interpreted. There may be poor quality, so it has to be repeated. The EKGs are often not in good working order, so they need to be corrected. So lots of issues with exam EKGs. So companies said, is there an alternative that we can try so that we don't have to go through the process of getting an electrocardiogram? So NT-proBNP is a blood test that can be drawn at the same time that the Chem 16 is drawn when an applicant gets blood work done. So could this replace an EKG as a proxy for what's going on with the heart? So enter NT-proBNP. It doesn't measure exactly what an EKG measures. So it doesn't measure electrical activity, which is helpful in regards to what we discussed before, but it does give us some kind of indication of how the heart muscle is performing in response to cardiac wall stress. So it can be a predictor of congestive heart failure and mortality risk. So what is NT-proBNP? So it's pro-brain natriuretic peptide, or pro-BNP, is released by the cardiac muscle cells when they are under stress. It splits into active BNP and inactive NT-proBNP. So BNP has been used in clinical settings, emergency rooms, hospitals, doctor's office, for its clinical and prognostic value. So why am I talking about the inactive fragment NT-proBNP? And For all you chemists that are watching this, you can see below what the structure is. But just think of the NT as being a nitrogen at the terminal. So that's what the NT part is. And the reason we look at NT-proBNP rather than BNP is because it's better suited as a life insurance screening tool. It has a longer half-life and has better stability in the circulation. It can be measured in the serum or plasma, collected in glass or plastic tubes, whereas BNP requires special tubes with anticoagulant. So insurance labs like Exam 1 and CRL can do NT-proBNP testing. The cost is less, maybe $25, so definitely less than an EKG and definitely easier to obtain. So insurance mortality studies, when NT-proBNP was looked at in terms of insureds, was done on people that were 50 years of age and up. So the information is less clear for ages less than 50. Very high levels of NT-proBNP, like greater than 1,000, were associated with increased mortality. Lesser degrees of mortality risk were associated with lower levels in a graded fashion down to 1 to 300 picograms per milliliter. The insurance labs may use 125 as the quote upper limit of normal. I just quoted the source of the Journal of Insurance Medicine here. So that is used by a lot of people as quote the upper limit of normal. NT-proBNP at very high levels can give us a pretty clear indication of possible congestive heart failure. However, at the lower levels, it's more variable. Normal levels in women run higher than in men. People age 70 and older tend to run higher in their level. So there's different normals by sex and age. So it's just kind of like an engine warning light. It tells us that there may be a problem and you need to have the quote mechanic unquote take a look. So there's a lot of conditions related to the cardiac function that can elevate NT-proBNP. So heart failure with reduced ejection fraction. NT-proBNP may be elevated in that circumstance. Or right ventricular failure, valvular heart disease. So there's all kinds of cardiac issues that may give us an elevated NT-proBNP level. There may be pulmonary diseases that can be associated with elevated NT-proBNP. So it's not specific. However, there are other modulators to NT-proBNP levels that have nothing to do with cardiac function. So NT-proBNP can be increased in things like hematologic malignancies, people taking estrogens or hormone replacement therapy, birth control pills, renal insufficiency or smokers, COVID, anemia, bacterial sepsis, burns, and toxic insults. And NT-proBNP can be decreased. Obviously, if someone's taking Entresto for cardiac failure, that will decrease the NT-proBNP if the Entresto is effective. Any other treatment for heart failure may also decrease the level, which would be good, and obviously what we're looking for if somebody has congestive heart failure. Obesity may decrease NT-proBNP. Biotin, so that should be stopped 72 hours before somebody has the blood test. So they should check their vitamins to make sure they're not getting any biotin in their vitamins 72 hours before the blood test. Tamoxifen and androgens can also decrease the NT-proBNP. So that's why minor changes at the lower levels especially, even though they may be rated in certain rating guides, you should take into consideration if there's any of these modulators that could be affecting the level. So that may not be in a young person, they may have more effect than actually representing any cardiac problems. So things to think about when you see a somewhat elevated NT-proBNP. This is just an example of how labs can be reported. And here, an exam 1 lab report for this company in Canada, they're actually reporting NT-proBNP, but the way the lab comes out, it says just proBNP. Actually, that means NT-proBNP. So you need to know what your lab is actually running and how the report is actually generated. So what are the takeaways? NT-proBNP is easier and less expensive than an EKG, but not measuring the same things. So it's a trade-off. Normal levels differ by age and sex. Obviously, super high levels are associated with higher mortality risk, and low levels are not. As we discussed, modulators can affect the level, especially at lower levels and at younger ages. Modulators may have more of an effect than actual cardiac problems. So applicants are not familiar with the test and may have difficulty challenging it because they won't understand exactly what this blood test suggests. So if a person gets rated for an NT-proBNP elevation, they may have difficulty understanding what to do, how to present it to their attending physician, and so they may have difficulty finding a solution to why was I rated and what can I do to improve my life insurance rating. So the Optimum underwriting team obviously is available to help on questions such as these. So this completes our brief trip down the NT-proBNP lane, and hopefully it helps you understand what this blood test can do and how some companies are using it in lieu of an EKG.